everybody. I'm Shelby Kinnear, National Program Lead at Diabetes Sisters, and we're so excited to have you join us today for our session entitled Effective Self-Advocacy, Strategies for Women Navigating Life with Diabetes. Whether you're living with diabetes or supporting someone who is, today's discussion will equip you with practical strategies to help you confidently advocate for yourself and for the entire diabetes community. Before we begin, a quick note, if you have questions or comments during the presentation, please use the Q&A. We'll address as many as possible after the talk is over. Now, it's my pleasure to introduce today's incredible speakers from the Diabetes Patient Advocacy Coalition, better known as DPAC. Erin Callahan is the Chief Operating Officer at DPAC, and she is a passionate advocate for access to quality care, medications, and devices for people living with diabetes. Diagnosed with type 1 in 1986, Erin brings a wealth of experience in social impact marketing, med tech mentorship, and policy development focusing on human-centered care. Amanda Kaufman serves as the Associate Manager of Communications and Partnerships at DPAC. Diagnosed with type 1 at age 12, Amanda has devoted her career to connecting people with diabetes to resources and support. With her background in communication, Amanda has been a tireless advocate for people living with diabetes. Together, Erin and Amanda will provide actionable tips for self-advocacy, explain your rights, and discuss how you can make a broader impact on the diabetes community. Please join me in welcoming Erin and Amanda.
Thank you. Thanks, Shelby.
Thank
that was
you.
Great. You already know us, so.
I know. I didn't even send you that. Like that was just, I don't know where you got that from.
I think the miracles of the internet, right?
Yeah.
So just as a matter of additional introduction, I'm still Erin Callahan, still the Chief Operating Officer of DPAC and also DLC, which is our affiliate organization. I'm a big sister for most of my life. But my favorite role my favorite role is being a big sister and a daughter and a friend and a dog mom. So I've got a lot of experience in the diabetes community. I've been working in diabetes for about 10 years. Prior to this, I volunteered in the diabetes community for quite a bit. And that's what really sparked my interest here. I was working in paper sales, so real life Dunder Mifflin, office full of Dwights, but as my bio suggests, I've always been in sort of social impact and social impact marketing and things like that. So I love working for people, and the greatest thing that I think we can offer to each other is service. And that means support, that means lending an ear. It means sometimes, as with the case of my old camp friends, going across state lines and creating a chain of people to deliver a sensor when somebody ran out, when they couldn't get their refill just yet. And that's advocacy too. And so we're here to talk a little bit about that today. Amanda, I'm going to kick it to you for a more personal introduction.
Yes, thank you. So I am Amanda. As Shelby mentioned, I run the communications and the partnerships at DPAC. I have been living with type 1 diabetes for 13 and a half-ish years. I live in Los Angeles. I initially got into the diabetes field because I ran my college's college diabetes network, which is now known as the Diabetes Link. And that was how I kind of became entrenched in the diabetes community. Prior to that, I did not know any people with diabetes growing up. But after that, I met a lot of people, and then I actually graduated college right when COVID hit, and none of us knew what to do. And initially, I was just going to work in diabetes as like a stepping stone because I was like, oh, well, you know, there are less people in diabetes, so I have a greater chance of getting a job there. But at the end of it, actually, I ended up staying here, and I really enjoy working with people with diabetes. And I no longer have to lie that I genuinely enjoy the diabetes field.
Well, thank you for your honesty, Amanda. We appreciate it. Look, we're all learning something on today's webinar. This is great.
Yeah.
So we're going to get started with our agenda and our goals for today. And we are here to talk about what it means to advocate in various settings and ways to ensure who is controlling our,
I am controlling it.
All right. My cues are not always the best, so you got to pay attention. I'll keep you on your toes, Amanda. We're going to talk about what it means to advocate in various settings, ways to ensure that your voice is heard. Nobody ever has to wonder what Amanda or I are thinking. We will have already told you. Share your story, and we're going to talk about the importance of that. And I'm seeing some comments in the chat and in the Q&A rather, which is what the function that we have open today, about some challenges that you're facing, some things that you'd like to learn a little bit more about. I have a personal reflection to share with you from this year that I'm still going through, so maybe you guys can help me too. We're going to talk about DPAC, of course, that's why we're here, and then ask you to join us in our advocacy efforts. So a little overview of DPAC and DLC before we get into what is advocacy writ large is DLC, Diabetes Leadership Council, is a 501c3 nonprofit organization. That's what most nonprofits are. With a 501c3, because we are tax deductible, just like Diabetes Sisters, there is a threshold that triggers certain flags with the IRS because of lobbying. So you can't donate your money to a nonprofit and have them do all the lobbying for you and you get the tax write-off for it. It makes sense when you think about businesses and caps and political contributions and things like that. Though there still is work to be done in that arena, I assure you. So DPAC is a 501c4. That means that we have no threshold on lobbying, and lobbying just means that anyone who is representative of DPAC can go into a legislator's office and say, hey, we would like you to vote yes on Bill SB 123. On the 501c3 side, where there is that threshold, they can go in and say, here's why insulin copay caps are important to me because I have diabetes. That is technically not lobbying. That is just educating, and that's what the DLC side of the house does. The DPAC side of the house, and why we're here today, we're the ones that can ask for specific bills. We can speak to specific parts of legislation, but that's why we have two organizations that have the same brand colors and very similar logos, so you understand the affiliation. And if anyone is familiar with the American Cancer Society and ACS-CAN, the Cancer Action Network, they have a very similar affiliation as we do with their 501c3 and 501c4 sides of the house. Any questions about that? Feel free to pop your questions or comments in the Q&A. I promise that we will get to you.
In the meantime, I will go into our slides. So something that lays the groundwork for us as an advocacy organization is the essential fact that advocacy in nature implies action. So advocacy versus support. To support something, all you have to do is say that you support it, but to say that you advocate implies that you have or are following through. And we may not always call it advocacy, but each of us advocates on a regular basis. So it could be discussing your care plan with your provider, telling just your family or friends what to do in an emergency, asking for accommodations at work or school, asking for help at the pharmacy, or just speaking up for yourself or others. Diabetes by nature kind of requires self-advocacy, even from the most introverted or the most self-sufficient person. Having diabetes kind of positions us as advocates, whether we like it or not. That's something that I learned after becoming an advocate, that actually I was doing it this whole time, because small scale emergencies kind of happen all the time and in public, and you have to be the one to tell people. And so I'd like to open the floor briefly, because I know we have a little bit less time than I thought, but does anyone want to share an example of when you successfully advocated for your needs with some kind of outside entity and what you think made it successful?
Amanda, do you have one to share to get us started?
I guess I think taking that when I advocate for, I guess when I was in college, I would individually go to each of my professors, as opposed to, I had the accommodations in place. That's something, well, I'll get into that soon actually, but it's something that you set up with the disability office. But in addition to that, I would go to all of my professors individually after class to make sure that they could tie the face to the situation. And I would frame it very much like, I wouldn't say it like this, but I knew that they didn't want to have a situation on their hands, basically. So I think what made it successful is that saying if I don't do this, then this will happen. So I need this to make sure that that won't happen. And I think that's perhaps a successful way to, I'm sure they would have accommodated either way, but I think that's a good way to frame it so that they know what's at stake if you don't get what you need.
Yeah, and that's a really successful strategy. And the reason, while it may sound like a threat to us, the reason that it's successful is because people simply don't understand. They don't understand what we go through. They don't understand what we live with. They don't understand what our day-to-day or even minute-to-minute lives look like. And that's why using your voice in both for self-advocacy and in policy advocacy is super important. Your college administration does not know what it's like to live with type 1 diabetes. They don't know what it's like to sometimes have a high or a sudden low that's impacting your functions. And similarly, legislators don't know everything, so they need to understand why it's important that we have copay caps on insulin, why it's important that we have choice in not only the providers that we have, but in the therapies and the devices that we're being prescribed. And these are some of the things that we do at DPAC, both understanding the needs of the community and deploying the voices and helping you understand how to share your story and how to share what's important to you. I can give a personal example too. This year I have had a number of surgeries on my ankle, and the very first question I asked in pre-op was, how is my diabetes being managed in the hospital? And they said, oh, the endo team will come and talk to you after your surgery. The endocrinology team came and talked to me minutes after I was out of the operating room and was all looped up on all sorts of things. So I was sure before surgery to say, I'm keeping my devices. I prefer to self-manage. Luckily, I was at a hospital that was very receptive to that. But I have been in environments that were not receptive to that, and you have to just keep pushing. You are the best advocate for yourself because you know your own story and you want the best care for yourself, and you have to look out for number one. And I see in the chat that we have someone saying having to advocate during airport security. Oh, goodness, yes. I knew I was legally able to bring a juice through. That's true. That's considered a medical device. And though it may seem silly to some, a juice box is actually a medical device to us. Also, through airport security, there's a lot of confusion as to what can or should go through the metal detector, can or should go through the body scanner. That is up to you to decide. It is not up to TSA to tell you. I once had a TSA agent when I said that I preferred to have a body pat down because I simply didn't know. I had some new devices and I wasn't sure what the manufacturers were recommending. And the TSA agent said to me, most people just go through here. And I looked at him and said, how do you manage your type 1 diabetes? And of course, he had no answer for that. And so I had to wait for a pat down, and that's fine. It's unfortunate that we do have to wait for things. It's really unfortunate that people try to fight us on what we know best. I see Denise saying, I just flew and it's so confusing. Each airport is different based on their size. Absolutely correct. The one consistent thing through all those airports and sizes and even other countries is you and you understanding what your needs are and advocating for them and speaking up. Thank you.
Yeah, and I have a couple examples of our advocates who actually have stories of successfully educating people around them. One is one person, I think this is the mother of someone with diabetes. The medical staff was telling her that her child actually can't eat, whatever she wants. She has to be on a specific diet. And subsequently, she chose to educate the medical staff that is supposed to be the one educating her daughter, but she had to educate them. And unfortunately, we are sometimes forced into situations like this. But due to the nature of these things, we tend to know a lot more than others about our own conditions, even in the doctor's office. And sometimes it really comes down to believing that you do know more and having the confidence to have that self-assurance. The second example here is this person. We actually met them at the Friends for Life conference held by our friends at Children with Diabetes in Orlando. This was only 1.5 years ago. So this advocate got a promotion and then lost her Medicaid coverage for her CGM, and the new prices under her employer were unaffordable for her. So she went to her HR person and actually got this policy, got Medicaid to cover CGM sensors, or not Medicaid, sorry, got her policy to cover CGM sensors for everyone under this huge conglomerate in America. We can't tell you exactly what it is, but it's a huge company. So that's a really big success. And actually, our sister organization, DLC, the one that Erin mentioned earlier, has an entire employer initiative dedicated to educating employers on how to structure their health plans to best fit the needs of people with diabetes and other chronic conditions. So these are two great examples of just how our advocates self-advocate and can change the rules for people, for their surroundings, and to kind of pave the way for more people with diabetes to have it a little bit easier.
And we've come a long way. Next slide, Amanda, on rights and accommodations.
Yes. So,
Great segue. It's almost like we planned it this way.
um,
Go ahead.
So the Americans with Disabilities Act, sometimes known as the ADA, not to be confused with the American Diabetes Association, set the baseline. This was established in 1990. This was really recent, and I was diagnosed with diabetes in 2011, so I don't even have any idea what it was like during this time. But I'm really grateful that I was alive and had diabetes during a time post ADA. But this kind of set the tone. And for work, there are some accommodations that you can get. For example, adjusted schedule. So if your endocrinologist says it's better for your diabetes management to not work mornings or to not work late night shifts, something like that, your endocrinologist can write a note and they have to accommodate that. And then, of course, a safe private place to check your blood glucose or to eat, to rest while you recover from a low or a high, breaks when needed, the ability to keep supplies and food on you, and then also the permission to use a stool or sit if necessary, if your job requires you to be standing for long hours. One aspect here that's kind of tricky is that you don't have to disclose in job interviews that you have diabetes. And you actually don't even have to disclose it when you work there. For your accommodations, you only have to tell the people where it's absolutely necessary, the people who are making sure that you get the accommodations, like HR. But a lot of people do choose to disclose it, both in job interviews and on the job, because at least in terms of job interviews, as much as they are interviewing you, you are also interviewing them. And it's good to know what kind of attitude they'll have about it when it's something so essential to your daily functioning. And I also just personally choose to disclose just in case of emergency, I would say. Are there any questions about work? Sorry, I haven't been looking at the Q&A.
I've got an eye on it.
Oh, okay. I'll go ahead and talk about school also. So school accommodations are very similar, breaks, supplies. One thing I didn't realize until after I graduated was that you can get early registration for classes. And that's a really big perk. And I think it's just in case something happens during that little window where everyone can register at the same time, and also so that you can get classes that fit your schedule, like that fit your body schedule. So having your phone in class is a big one. That's part of the reason I approach professors after class to let them know, like that girl who was on her phone during class, she actually needed to be on her phone. Extended time for tests or for deadlines. For grade school, I am sure a lot of you are familiar. The 504 plan is something that you coordinate with your school administrators, and you would write all of your accommodations in there. There are tons of samples online that you can model it after, and it really depends on what you need. One of our advocates actually got her diabetes support dog, or I don't know exactly what it's called, written into the 504 plan. And also her daughter was exempt from PE actually, because they frankly were not fully comfortable with that like liability. And also they knew that she was getting a lot of physical education outside of school. So they just told her she doesn't have to do PE at school. So it really is very customizable. It depends on how flexible your school administration is. But those are the kind of things that you can get with the 504 plan. And the 504 plan doesn't carry over to college. In college, the student has to go individually and talk to the office. Let me see. If there are no questions, we could just go on to talk about other places, which includes the airport, as someone mentioned, amusement parks, museums, concerts, and court proceedings. You'd be surprised the amount of places that you can get accommodations. And unfortunately, we do a lot of like picking our battles. We don't always do it. And unfortunately, we do live in a world that's very catered toward, fully able-bodied people. But like someone mentioned in the chat, I do find that it is sometimes worth it to bring your juice because you don't want to pay another $8 for juice after security when you actually need it to live.
I want to touch on the other public places part for a moment. One that's very relevant to me and something that is very near and dear to my heart is Walt Disney World. I'm a Disney person. I'm a Disney adult. My whole family is. We're all Disney grown-ups. My parents are there right now, in fact. And Disney used to have, well, they still have what's called the Disability Access Service. And as we all know, living with diabetes or prediabetes, there are things that happen in our body that just do it without us telling them to. Most often, they do it without any sort of warning. And especially in an environment where it's very hot, where you don't know the carb counts on the food, where you're doing a ton of walking, and where there could be a lot of excitement. So emotions, all of these things are part of the, I think, 42 influences that impact your blood sugar. And that's a lot. And Disney used to allow a disability access service for type 1 diabetes. As of May 20th this year, they are not asking for diagnoses, and they're only giving the disability access service for cognitive disabilities or neurodivergence. And typically what we're seeing is that they're giving it to folks who are on the autism spectrum and impacted by not being able to wait in line for long periods of time. We all know that there are days that we have no problem waiting in line for long periods of time. There are days when sometimes diabetes is just not at the top of my mind, and that's great. If I can forget about it, that's a good day for me. But many days we are looking at the highs and looking at the lows, and we're making sure that we're trying to get ourselves somewhere in between. Typically, my blood sugars even out overnight because I haven't had a chance to screw them up yet. And I think that that's probably the best way to describe it. But with this access service, I applied for it and I tried to test the theory a little bit because as advocates, we have to look out for ourselves. So I called and I said, sometimes my blood sugar will go very high or it'll go very low, very suddenly, especially if I'm walking around a lot in the heat and then I'm in a cool area and I'm not walking around, that's when my blood sugar will crash, specifically when I'm in a line. And I've seen this happen. I've had experiences at Walt Disney World that I've been challenged by. And it did not qualify for a disability access service. So that is something that DPAC is taking up. We're working it through our executive committee, and we're in the process of writing a letter to Disney. We're going to start by saying, hey, it seems like you don't know a lot about type 1 diabetes. Let us help you. But as soon as they come back and say, oh no, we know everything we need and you don't qualify, that's sort of when the gloves come off. So your best route in advocacy is always to say, oh, I guess you don't know about that. Let me help you understand. But after that, you still have to keep pushing. And Disney person that I am, I want to make sure that I have an equitable experience because, again, there are times that I can stand in long lines, no problem. But there are days when I'm battling a high blood sugar or low blood sugar, or my site came out overnight, or something is not working, and I have to spend extra time that those who don't have diabetes do not have to spend. And I don't get a discount on that ticket, and those things aren't getting any cheaper. Similarly,
Yeah.
at museums, in court proceedings, in concerts, in stadiums for games and stuff, there are often limitations on the size of purse you can bring in. If you need, if you have a medical condition and you need to carry supplies with you, as we all do, we absolutely can take advantage of handicap services, which is what it's called at most venues, and go in a separate entrance, which is kind of a perk because sometimes those lines are shorter. And they're very, very accommodating in all of the experiences that I've had. They've been very accommodating about not only the larger bags to accommodate any sort of medical supplies, but also more accommodating with regard to the metal detectors, which are typically like shoulder to shoulder for everybody else. They have more space so that you can go around them if you need to accommodate your devices.
Yeah, and keep in mind that it is truly in everyone's best interest if you do not faint or have a seizure on their premises. And I think Disney could probably take a few notes from that as well.
Yeah. I see we do have a couple of comments in the chat from Ms. Stark, I'm going to say. Do insulin pumps stop the highs and lows? Insulin pumps certainly can, for those who are insulin dependent, certainly can help regulate your diabetes in a quicker fashion because they rely on smaller amounts of rapid acting insulin as opposed to a longer amount of basal insulin, which you're taking to keep you at a basal rate of whatever you and your doctor decide, and then bolusing for your meals and for your carb intake. So certainly talk to your medical provider about that. And there are lots of resources just out on the Google about all the different devices that are available, not only in the US, but also in other countries. Also, always be sure to check with your insurance company on what they are approving. One of the things that we fight for is to ensure that patients have choice because not every car in the parking lot is a Buick. And we want to make sure that if you like an Omnipod and that works for you, you should have that. If you like a Dexcom or a Libre and those work for you, you should be able to have those and that you have that choice available to you. Also that you have options if something goes wrong. I do see a comment here also from Ms. Stark. While you advocate for type 1, please don't forget about those with LADA. Yes, I understand LADA. We actually advocate for all types of diabetes. I realize that this all sounds very type 1 focused because we are talking about insulin and syringes and CGMs and things like that, which a larger population of people with type 1 tend to use. However, people with type 2 also need these accommodations, and there is no exception to the type of diabetes that you have, whether it's LADA, type 1, type 2, gestational diabetes, cystic fibrosis-induced diabetes. I think there are 2 or 3 others. MODY is one of them. All of you qualify for these accommodations for sure. And at DPAC and DLC, we advocate for the rights of people with all types of diabetes, including those living with and at risk for prediabetes. So we do talk quite a bit about advocating for obesity care and weight management because we know that that is become a very hot button. I saw a comment a little bit earlier about access to Mounjaro, one of the questions in the chat. That's something that we're really working on very hard at DPAC and DLC is to ensure Medicare coverage for anti-obesity medication. So stay tuned for that. On the subject of insurance and coverage, know your rights. Like I said, you've got to be sure that what you're asking for is covered. You have to make sure that if you are asking for something that's not covered, that you are going through the right channels. If you do that, you have the opportunity to appeal any denial. And we live in a world of pharmacy benefit managers managing what we call utilization management practices. And I wish we got paid by the syllable. But things like prior authorizations, things like step therapy, or sometimes called fail first. Why are we living in a world where patients have to fail on something before they get what they need? That's crazy. So we encourage you to appeal any denial. A no is not the last answer. It's just a reason to ask again. There are emergency appeals available in insurance that especially can help with diabetes-related items. Many states have actually passed emergency coverage for insulin as well. Sometimes it's called Kevin's Law, sometimes it's called Alex Law. And in various states, they have emergency provisions, but check your state. And we will put something, Amanda, can you put in the Q&A or maybe in the chat? I'm not sure what anyone can see. Maybe Shelby could help us out. diabetespac.org/handbook. In there,
Yes.
you can see the scorecard for your state and how your state measures up. Once again, with insurance, push until you get a yes. They will get tired of you, and that's okay, but you got to wear them down. Also, if you are covered by an employer-based plan, so if you get your insurance through your employer, like Amanda and I do, call your HR department or those who are responsible for designing the benefits plan. Even if you and your neighbor both have Blue Cross Blue Shield, for example, that doesn't mean that your benefits are the same or that your costs are the same. Those costs and benefits are determined by your HR department or by your benefits administrator. So make friends with them. maybe give them a special note at the holidays and make sure that they understand what your needs are. Be that squeaky wheel. That's exactly what happened with the coverage for the woman that Amanda talked about on the CGM, who was able to get coverage for CGM for the entire organization nationwide.
Yeah, we actually also have on our website, I put the handbook link in the chat, by the way. And on our website, we also have some more resources for, we have a brown bag webinar on insurance that's an hour long, just talking about what to do in emergencies with our resident experts, George Huntley, Stuart Perry, and Sarah Long, one of our advocates. So those are also, we'll get into it later, but those are also the kind of things that we have webinars about as well. And we would like to understand your story here. So I'm not sure what the easiest way to do this is, maybe to click raise hand. So raise your hand by the raise hand function on Zoom. If you or someone you know has ever been surprised by high out-of-pocket costs for a prescription. And also I'm realizing I don't see when people raise their hands.
Oh, Shannon's disabled, so the link's not there. Sorry about that.
Yeah,
We'll make sure that we get this
Yeah,
too.
let's see. Yeah, I can see the raise.
Thank you.
Okay, okay.
We'll just have to unmute them as we call on them. So
Okay, well, we don't need to call. This is more just to get a gauge of, you know, who has experienced what. And also, we usually give this presentation in person, and usually people look around and see how many other people have experienced the same thing that they have. So I'm assuming a lot of people have raised their hands, and we can just go.
yeah, I can unmute them and call on them if you want to do that.
We need to put it in the Q&A. Let's move on from this.
Okay.
Yeah,
Q&A. Yeah,
we can
thanks.
put in the Q&A if you want to share a specific story about any of these that happened. Oops. Okay, and then we have these questions about policy advocacy. And similar concept, we don't need you to raise your hands here, but have you, just something to ponder, have you gone to your elected official about something important to you? Have you ever had a meeting with an elected official or their staff? And part of what DPAC does is we're here to help you realize just how valuable your story is, and not just in everyday life, but with legislators. And I guess we'll pose this question: what is stopping you from taking it to that policy level? And what has either been intimidating or perhaps even defeating? What has stopped you?
I would like to see answers to that in the Q&A. It can be very intimidating to think about going to meet an elected official. But the fact is that anybody can run for office and anybody can get elected. And that doesn't make them an expert on anything. It certainly doesn't make them an expert on your experience. And that's what we're here to encourage you about, is to make sure that you're sharing your story and talking about your needs in at an amusement park, as I so passionately detailed the challenges at Disney World, or with your employer, or with your school, or anywhere that you are, is not at all different than talking to an elected official.
Mm-hmm. Yeah, so we are here to kind of demystify that difference. So DPAC provides you with the opportunities to do so and the talking points. That's what we're here for, and where you fill in the blanks is at your story. So the picture on the left is a stock photo, but the picture on the right is actually from our Hill Day last year. So 2 of our advocates are there talking to their legislator, and they have a packet of information in front of them they were given beforehand and for reference during the meeting. But they're talking about how diabetes impacts their lives firsthand, and that's not in the packet. That is something that drives home all the facts and the data that they're presenting. And it's not always in-person Hill Days in DC. We also do virtual meetings, testifying in your state capital, petitions, letters to legislators, and sometimes we connect our advocates with other ways to tell their story. So we can connect our advocates to news outlets like New York Times, Wall Street Journal, Health.com, Yahoo, etc. And we've been able to help many of our champions share their stories with these major news outlets so that they can help pave the way for other people as well. And we are realizing shorter on time than I thought. So let me just breeze through this. This is the part where we try to break it down and explain why advocacy, not just policy advocacy, but advocacy in general, is not quite as intimidating as it seems. So our advocates have had several stories. Some of them say, I got help for myself, so I want to pay it forward. Some of them say, I didn't get help and I figured it out all on my own. So I want to make sure other people don't have to go through that. Some people simply, I have a loved one with diabetes and that's it. Some people, diabetes is hard enough and I have to manually keep myself alive 24/7. So I don't want to worry about other things. I hate worrying about whether my costs are going to change. And I think tapping into that why is really where the empowerment comes from, especially when you think about how you're doing something so that someone else in the diabetes community or someone in the future doesn't have to. So that's the why. We're just letting you know that telling your story and sharing your experience with legislators and policymakers does seem intimidating, but it gets easier every time you do it. And like Erin mentioned earlier, anyone can get elected. They don't know better than you about diabetes, especially not your story. It also only takes 7 people to put an issue on a legislator's radar. So 7 different people calling the office or 7 different people having a conversation about one topic. Then that staffer highlights that issue and brings it to the elected official and says, this is something that people need you to respond to or need you to act on. One thing that I also learned after joining DPAC is there are no permanent friends and no permanent enemies in politics. People's votes change all the time. It's kind of just like a game. And if even if things don't change immediately, you could be planting a seed for change, whether you know it or not. Yeah, but we'll just breeze through this, honestly. We're short on time.
I do want to get to a couple of things in the chat, Amanda.
Okay.
And one of them is, are there templates for advocacy that are available online or in the handbook? We do not have templates for advocacy necessarily. DPAC has an advocacy academy that we launched a little bit earlier this year for those who are interested in doing a little bit more. It's something that we're actually working with your friends or your partners, our friends at Diabetes Sisters on, is to make this available for Diabetes Sisters members, and to make sure that we are giving you all of the tools that you need. If there is something that is important to you, if there is something that is burning in your state or in your head or your heart, and it is related to diabetes policy, you can always reach out to us. And at the end, maybe Amanda, we could put up a couple of links. One of them, info@diabetespac.org, which is our general info line, which is truly monitored by a human. That human is Amanda Kaufman. And also the diabetespac.org/handbook. It looks like we've got a couple of people who are asking for that.
Right, Erin, just so you know, we will be sharing all of these links via an email afterwards. So don't worry about dropping them in the chat or anything. The chat is not functional, so.
Got it. Thank you. I see that we have a comment. I choose to utilize a copay card for my insulin from the manufacturer since it is not a chosen insulin for me. It's just easier to pay the $70 every 3 months and a lot cheaper until I reach my deductible or out of pocket. I love that you are aware of that resource. It's excellent. So many people don't know or are unaware of some of those options to help cut the cost. I do want to tell you a little bit about copay assistance programs. That is called within insurance, there is a utilization management practice, as I mentioned, called copay accumulator plans, copay accumulator adjustment programs, CAPS, as we call them. That means that if you are getting, let's say, Humalog, I'm going to pick on our friends at Lilly, and your insurance is United Healthcare. I'm going to pick on our friends at UHC because I've got a bone to pick. And your insulin cost is like, let's say $100. And you feel like that's too much. But Lilly has a manufacturer coupon or manufacturer assistance program where you can get it for $35. That's great. It's saving you $65, which is awesome. Lilly is actually paying that to your insurance company who owns the product so that you can have it, which is great. But you are not getting the credit for that, and your insurance company is getting paid twice. So with with prescription drugs, your insurance company actually negotiates the price on them from the manufacturer. So when you buy them, you are buying them technically from your insurance company, who has bought them at a significantly reduced price. Then they determine what your cost is. With the manufacturer coupons, they're charging you the list price, which is the pre-negotiation price. And they're saying, well, but they know that they have coordinated and they have negotiated with Lilly to only pay a certain amount for that. Lilly is now paying again for you to have that product. But also, you're not getting the credit for that $65 coupon. Think about it this way. If you couldn't afford your medication and you put up a GoFundMe, or you have a wealthy aunt who said, I'm going to help you and give you $65 every month so that you can pay that full $100. That $100 is going to come off of your deductible at the full $100 because the insurance company is being made whole. They're getting paid. With the copay accumulator adjustment programs and those manufacturer's assistance, they're actually getting paid twice. Not only by you and Lilly, who make up that $100, but then also they're keeping that gap in your deductible. So eventually they will get paid again until you reach that deductible because they're not crediting you for the manufacturer assistance programs. The reason I go into detail on this is because DPAC and DLC filed a lawsuit against the federal government on this, and we won. And the federal government came back and said, you won, but we're not going to enforce it. That's crazy. So we have to keep fighting for these things. There's also a lot of work being done at the state level to ban copay accumulator adjustment programs through state exchange plans. And we continue to work on that too. But I'm glad that you're finding the lower cost product. That's great. We're going to keep fighting for you so that the system changes and you get all that credit that you deserve.
Yes. I do have to jump in 5 minutes, so we'll just breeze through. We actually have, I know the links will be sent after, but here's the QR code to exactly the link that we tried to send in the chat earlier. So this just provides you with the page that shows you the scorecards for all of the states. So we measure each state's progress on several metrics, and the metrics are also defined on that page. And Erin talked a little bit about our work at the state level too. Erin, if you want to like just really quickly give an overview of our PPPC work.
Yeah. So again, one of the things that we work on is very, very nuanced. Of course, we push for $35. It's like copay caps across the board. Of course, we were in favor of the Inflation Reduction Act and the provisions that were given to people with diabetes. But of course, we were very disappointed that not everybody was included in that. So while we work on the things that everybody's aware of, we also work on the real wonky stuff. One of them is we have a coalition called the Patient Pocket Protector Coalition, and we reach across chronic condition spaces because these problems, these challenges with the negotiated prices and the copay accumulator adjustment programs are not exclusive to diabetes. We know that our friends who are battling cancer and our friends who are battling rheumatoid arthritis and mental health challenges, they are also facing these same problems. Anyone who takes something every day, every week, every month is battling these problems. It's not exclusive to pharmacy, to the meds you get at the pharmacy. It also happens for doctor administered medications, which of course are way higher priced. So the work that we're doing is to ensure that patients are receiving the benefit of the lowest negotiated price. As I mentioned, insurance companies and PBMs rather on their behalf negotiate the price with the manufacturer. We want to make sure that patients aren't overpaying for their product, for their drugs. Insurance works a lot like Costco and Sam's Club. Costco and Sam's Club, we're all familiar with that. You pay a membership, so that's your dues, and you get a card that goes in your wallet, and that gives you access to toilet paper and chickens, and you get a reduced price for those things because Sam's Club and Costco have been able to buy in bulk. Insurance is no different. Thanks to claims data that they have access to, they're able to buy prescription drugs in bulk. What they are not doing is passing along the benefit of that bulk price to their members. You even get a little card that you carry in your pocket. You pay your dues through your premium every month for health insurance, but you're not receiving the benefit of those prescription drug low prices. And you're in fact lining the pockets of insurers and pharmacy benefit managers. And we are the most vulnerable citizens out there. Insurance works so that it's pooled risk. And those who have no health challenges are helping the rest of us by also paying into that program. But what what negotiated rebates, staying with insurance plans and PBMs are doing are actually bastardizing that theory, and they're harming people because folks are walking away from the pharmacy without their prescription meds, which of course we all know is so dangerous. Also, please don't do that. If you need help getting insulin, go to insulinhelp.org. It's a wonderful, wonderful site. If you have any specific questions, reach out to us.
Thank you. Wow, that was the quickest I've ever heard you give that spiel. And if that is confusing, we also reach out to us and we'll help explain more. This recording is available. We have resources on our website about all of this and more. I guess to wrap it up, these are some of the DPAC programs and highlights. So we, as I mentioned, bring our advocates to the Hill on occasion. We were able to do it for around 50 of our advocates last year. That was 49 people in 28 states. So we talked about our legislative priorities. We had meetings all day for a couple days. And another thing is that we have our Champion Corps. That's a smaller, more tight-knit group within our larger base of champions. Currently in our entire base, we have around 7,000 people in all 50 states, but the Champion Corps is kind of our hand raisers. We meet with them every 6 weeks. We're all friends. And these are the people who we like to feature a lot on our social media because they like to. Our blog, social media spotlights, our brown bags. Brown bags are our monthly webinars. That's what I have to jump to right after this. We're doing a webinar today on caregivers and loved ones. So actually Erin's sister will be on that presentation too. It'll be the loved ones of people with diabetes, just talking on a panel about what it's like to have a family or friend with diabetes. And other topics we do mental health and stigma. We do type 1 diabetes screening, research developments, and we have leaders in the field, and we also feature our advocates a lot. And this is just another way to show you how many cool things we do with our advocates. And I want to show you actually this video that we have that we just put together of our advocates. And while you're watching it, feel free to scan this QR code. It takes you directly to our website.
Hi, everyone. My name is Ina. Hello. My name is Kay.
My name is Sarah.
My name is Hannah.
My name is Joshin.
My name is Chandra.
My name is Carrie.
My name is Bridget.
My name is
Amanda, I think the audio
Yeah,
cut
we
out.
lost.
I advocate for finding
Oh, sorry. Can you hear
to
it?
know the healthcare system and receive guidance from other people. And I think everybody should receive the same guidance and help.
After being a nurse for over 3 decades, I then became the primary caregiver for my sister, who is also a type 2. And now I'm involved so that I can make a voice for those people, for my sister, for other loved ones who don't have the opportunity.
And I think it's very important that policymakers understand that when they make decisions, it affects normal, real people like myself, anywhere from older adults to children. Advocating alongside DPAC has really shown the power within this community and together that we can really create a change. And that is my biggest reason on advocating.
I advocate because I know how important it is to have access to quality healthcare along with affordable medication. Changes are being made to make life easier for people with diabetes. So that's why I'm proud to be a DPAC champion.
I'm a DPAC champion because DPAC people are just like me, and they inspire me every day.
Sorry about that. I muted myself thinking that it would help things, and then I realized I muted part of that video. But I'm hoping that it was essentially, you saw most of it, Shelby.
We did, yeah, I think we got the gist, so that's perfect, thank you.
Hey, thank you. I think we can move to Q&A, but I just have to jump to my...
I can stay on. That's fine.
Okay. See you, everyone.
Thanks, Amanda.
Yeah.
Bye.
Thanks, Amanda. So appreciate the questions. And Aaron, we certainly appreciate your time. We learned so much. We will be sending out a survey after this. So if there were things you didn't get to say that you wish you had been able to say, please put them in the survey and we'll make sure you get answers. But I just wanted to tell you before we close, again, thank you, Aaron, for sharing today. I just wanted to update you on a couple of events we have coming up in December. On December 3rd is Giving Tuesday. Giving Tuesday is a global day of generosity, and it's the perfect time to support the mission of Diabetes Sisters. This year, we're excited to share our cookbook, From Our Table to Yours, Recipes from the Diabetes Sisters community, a collection of recipes contributed by our members. For a $25 donation, we'll send you a copy of the digital cookbook, and know that every dollar raised will go directly towards supporting impactful programs, resources, and speakers that will empower women who are living with or at risk for developing diabetes. So that's December 3rd. December 10th at noon Eastern Time, we'll have our Unboxed series, Smart Shopping Made Simple, Navigating Food Labels with GoCoco Scanner. Discover how GoCoco's health score and diabetes alert features can help you make healthier food choices. Plus, Diabetes Sisters members will receive a free year of premium access to GoCoco. On December 12th at noon Eastern, Beyond the Blood Test, Quinn's menstrual pad for seamless A1C tracking. Quinn's co-founder and CEO, Dr. Sarah Nasseri, will do a deep dive into the science and future of her innovative product. Learn how it's reshaping diabetes care and empowering women with new health insights. So be sure to visit our website and DPAC's website for more information. And remember, all of our webinars are recorded and available on demand for your convenience. Thank you so much for joining us. Thanks again, Aaron. Have a wonderful day. And remember, advocacy begins with you.